Over the years, it is natural for the body to undergo physical, hormonal, and emotional changes. Old age brings with it a new perspective on life and, inevitably, on sexuality. Many believe that sexual desire fades with time, that intimacy ceases to make sense after a certain age. This view, however, is a reflection of old taboos, rooted in a culture that still finds it difficult to talk openly about sex in old age. Among the most common myths is the idea that masturbation after a certain age is unnecessary or even harmful. The truth, however, is quite different. According to several studies in the field of urology and sexual health, masturbation in old age is not only healthy but highly recommended, especially for men. Masturbation, when practiced consciously and regularly, can bring numerous benefits to the physical, emotional, and even social health of older adults. First, it is important to understand that sexuality is an intrinsic part of being human, which does not disappear with time. Desire can indeed be transformed, resized, but it remains alive, especially when it is respected and welcomed without guilt or shame. And this is precisely where masturbation plays an essential role. It allows individuals to reconnect with their own bodies, with pleasure, and with the feeling of vitality that sex life provides, even if in solitude. Physically, one of the main benefits of masturbation in old age is related to prostate health. Regular ejaculation helps to empty the prostate gland, preventing the accumulation of secretions that, over time, can contribute to inflammation such as prostatitis, as well as helping to prevent benign prostatic hyperplasia. Many urologists emphasize that maintaining a healthy frequency of ejaculation is associated with a lower risk of developing certain types of prostate cancer. In other words, masturbation can be seen as a type of intimate exercise that preserves the function of the sexual organs and contributes to a healthier urological system, but the positive effects don't stop there. Another important point is the impact of masturbation on blood circulation. During sexual arousal, blood flow increases significantly in the genital and pelvic regions, which stimulates the vessels, improves muscle tone, and even helps control blood pressure. In addition, this increase in flow is also associated with the release of substances such as dopamine, serotonin, and endorphins, neurotransmitters that promote well-being, pleasure, and relaxation. For many older adults, this release of hormones is a true natural remedy for stress, anxiety, and even symptoms of depression. Emotionally, masturbation offers a safe and autonomous means of sexual expression. Many older adults find themselves alone at this stage of life, whether due to widowhood, separation, or difficulties in finding sexual partners. In these situations, masturbation emerges as a legitimate way to continue exercising sexuality without depending on the presence of another person. More than that, it allows individuals to maintain a connection with their intimacy, their sensuality, and their ability to feel pleasure. This in itself is a great antidote to feelings of abandonment, rejection, or uselessness, which unfortunately are still common among older people. It is also necessary to talk about the role of masturbation in strengthening self-esteem. In a society that overly values youth and sexual performance, many older men begin to doubt their own masculinity, their value as desiring and desirable subjects. By allowing themselves to feel pleasure, by touching themselves with respect and presence, they rebuild a positive relationship with their own bodies. They learn to value their sensations, their abilities, their history. Masturbation, in this sense, becomes a gesture of self-care and empowerment that says, I am still alive, I am still capable of feeling, I still deserve pleasure. It is also worth noting that masturbation can be a way to get to know your own body better in this new phase of life. With aging, it is common to experience changes in sensitivity, speed of arousal, and intensity of erections. Knowing these changes helps men deal with them more calmly, without unnecessary frustration. By masturbating frequently, he learns what works, what pleases him, and what has changed. This body awareness can be extremely useful if he becomes involved in new relationships, as it allows for a safer, more mature, and more satisfying sexual experience. Naturally, it is essential that all of this be experienced without guilt or shame. Masturbation is not an addiction. It is not a moral weakness, much less an inappropriate practice for older people. On the contrary, it is part of a natural process of caring for the body and mind. When practiced with balance, respect, and freedom, it can be as therapeutic as a walk or a good conversation. It is a moment of reconnection with one's own essence, with what makes us human, the desire to feel, to love, to be at peace with oneself. So, if you are an older man and have ever wondered if you still can or still should masturbate, know that the answer from experts is clear. Yes, you can, and you should if you feel like. More than just a sexual act, masturbation in old age is a choice of health, self-care, and dignity. It is a right that should be exercised with pride, without taboos, without fear, and with the full awareness that pleasure has no expiration date. We live in a society that has long associated sexuality with youth, physical vigor, and performance. For decades, a collective imagination has been built in which aging automatically meant the end of sex life. Old age was seen as a phase where pleasure became irrelevant and desire almost a mistake. This type of thinking is not only wrong, it is deeply harmful. What few people know, and many avoid discussing, is that prolonged absence of sexual activity, including individual forms such as masturbation, can have real consequences for the physical, mental, and emotional health of older adults. Sexual inactivity is not just a matter of choice or circumstance. When it becomes constant and is not compensated for by other forms of intimacy and stimulation, it can become a silent risk factor. From a physiological standpoint, prolonged sexual inactivity causes significant changes in the body. In men, one of the most visible impacts is reduced blood flow to the penis. When there are no frequent erections, even if they are spontaneous or induced by masturbation, the body stops sending blood to the erectile tissues on a regular basis. Over time, this can cause gradual atrophy of the structures responsible for erection, making sexual response even more difficult in the future. It is a vicious cycle. Lack of sexual activity impairs performance. Impaired performance discourages further attempts, and so on. In the long term, this can contribute to the development of erectile dysfunction that is not hormonal or psychological in origin, but rather functional and vascular. In addition, the absence of regular orgasms and ejaculations can directly affect prostate health. Studies show that men who maintain an active sex life throughout their lives, even after the age of 60 or 70, tend to have a lower risk of prostate inflammation and a lower incidence of benign hyperplasia. Frequent ejaculation acts as a kind of natural cleansing, preventing the accumulation of secretions that can promote infections or cellular changes. When this stimulus disappears completely, the body stops performing this important physiological cycle, paving the way for the emergence of urological complications common in older adults. Hormonal health is also impacted. Although testosterone levels naturally decline with age, sexual activity helps maintain production at healthy levels. Contact with pleasure, arousal, and orgasm activates neurological and hormonal systems that keep the body in balance. When these stimuli cease completely, the body understands, symbolically and literally, that desire is no longer necessary. This can accelerate hormonal decline, with side effects ranging from muscle loss to increased abdominal fat, as well as energy loss, discouragement, and low self-esteem. It is as if the body begins to shut down vital areas due to lack of use, reinforcing the feeling of premature aging. But perhaps the most profound effects of sexual inactivity are revealed in the psychological and emotional realm. Sexuality is not just a physical act, it is also language, expression, identity. When an older person stops touching themselves, allowing themselves to feel desire or pleasure, they may gradually begin to disconnect from their own individuality. Feelings of loneliness grow. Self-confidence weakens. It is common for the absence of a sex life to be accompanied by feelings of worthlessness, guilt, or shame. And these feelings, silent and often unspoken, have the power to undermine anyone's well-being. Even more so for someone already facing so many other changes typical of old age. Another important point is that sexual inactivity can be a reflection of emotional neglect, social invisibility, and even lack of access to information. Many older adults simply do not know that they are entitled to pleasure. They were not taught to respect their own bodies, to seek touch with love and without guilt. Many others live in homes where there is no privacy, or in relationships where affection was lost long ago. In these cases, the absence of sexuality is also a sign of emotional neglect, of silent abandonment, and when this continues, it can open the door to depression, chronic anxiety, insomnia, and even cognitive disorders. It is important to note that sexual activity does not necessarily involve another person. Self-touch, masturbation, and contemplating one's own body with affection and curiosity are valid and effective ways to keep this connection alive. This is not a call for performance, but rather an invitation to self-care. Just as we nourish our bodies and take care of our skin and hair, we must also nourish the vital energy that pulses within us, and which is expressed, among other ways, through desire. Denying sexuality in old age is denying an essential part of human existence. More than that, it is giving up a powerful tool for health, longevity, and self-esteem. We are not just talking about sex in the traditional sense, but about pleasure, touch, and stimulation. We are talking about the ability to keep the spark of life alive, even as time marches on. Sexuality, when experienced in a healthy, conscious, and non-judgmental way, is one of the greatest allies of aging with dignity. We must abandon myths, break the silence, and give older adults back their right to be desiring beings. Sexual inactivity should not be seen as an inevitable fate, but rather as a warning sign. When possible, it should be replaced by intimate, affectionate, and pleasurable practices. And when this is not possible, it should be discussed with respect, acceptance, and listening. The body continues to demand attention. The soul continues to demand connection. And pleasure, even in old age, remains a legitimate path to health and meaning. For a long time, male sexuality has been surrounded by myths and misinformation, especially when it comes to solitary practices such as masturbation. Conservative culture and medical silence on the subject have contributed to many men, especially older men, growing up believing that individual pleasure is taboo, a sin, something to be abandoned with age. However, with advances in medicine and sexology, these views are gradually being deconstructed. Today, masturbation is recognized not only as a healthy practice, but also as an important ally in the prevention of diseases that directly affect men's health, especially in old age. And one of the areas most impacted by this practice is undoubtedly the prostate. The prostate is a small gland located below the bladder that is part of the male reproductive system. Its main function is to produce part of the seminal fluid that mixes with sperm during ejaculation. Over the years, especially after age 50, the prostate undergoes natural changes that can lead to alterations in its size, function, and cellular structure. Among the most common problems are benign prostatic hyperplasia, a benign enlargement of the gland, prostatitis, inflammation of the prostate, and of course, prostate cancer, one of the diseases that most affects men in old age. It is in this scenario that masturbation comes in as a preventive practice of surprising value. According to several scientific studies, regular ejaculation, whether through sexual intercourse or masturbation, contributes significantly to maintaining prostate health. The reasoning is simple. The more a man ejaculates, the more he empties the prostate, preventing the accumulation of secretions that, over time, can stagnate and create an environment conducive to inflammation, infection, and cellular changes. One of the best-known studies on the subject was conducted by researchers at Harvard University and published in the Journal of the American Medical Association, JAMA. The study followed more than 29,000 men over nearly 2 decades and found that those who ejaculated more frequently, about 21 times per month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times during the same period. The results were consistent even after controlling for other factors such as diet, family history, and lifestyle. The medical explanation for this effect lies in the physiology of the prostate itself. When prostatic fluid remains unexpelled for long periods of time, it can undergo biochemical changes, becoming a breeding ground for chronic inflammatory processes. In addition, lack of ejaculatory activity can lead to prostatic congestion, a condition in which the gland becomes sensitive, swollen, and painful, often mistaken for prostatitis. By maintaining a healthy masturbation routine, even if not daily, men help ensure that their prostate remains active, functional, and clean, reducing the risk of developing these uncomfortable and, in some cases, serious conditions. But the benefits go beyond the physical. Masturbation also plays an important role in how men perceive their own bodies, especially at a stage in life when vitality is often called into question. By staying in touch with their pleasure, older men maintain an intimate and conscious relationship with their genitals, recognizing warning signs more easily and noticing changes in urinary flow, pain, discomfort, or changes in sensitivity. This body awareness facilitates the early diagnosis of any prostate abnormalities, which in itself is a determining factor in the success of medical treatments. Unfortunately, many men avoid talking about masturbation with their doctors, which is understandable, given the cultural and emotional weight surrounding the topic. However, it is essential to understand that sexuality is an integral part of health, and that taking care of the prostate is also taking care of overall quality of life. A urologist is not there to judge, but to guide. Today, most experts recognize the positive role of masturbation in men's wellness routine, especially after age 60. Another factor that cannot be ignored is that with aging, opportunities for sexual activity with a partner may decrease for a variety of reasons: widowhood, physical difficulties, illness, loss of libido, or changes in relationship dynamics. In these circumstances, masturbation becomes a viable, accessible, and effective alternative to keep the prostate functioning and preserve the benefits of regular ejaculation. It is also necessary to deconstruct the idea that masturbation in old age is something shameful or pathetic. On the contrary, it is a gesture of health, self-love, and respect for one's own body. Men who understand this and allow themselves to continue exploring their sexuality naturally reap benefits not only in the prevention of prostate disease, but also in self-esteem, physical well-being, sleep quality, and hormonal balance. Orgasms release endorphins, improve circulation, and relieve tension, all of which are pure medicine, free and at your fingertips. Talking about quality of life in old age requires a holistic view, a deep understanding that well-being is not just the absence of disease or physical limitations. Quality of life involves the body, mind, emotions, relationships, and, without a doubt, sexuality. For a long time, pleasure was seen as something exclusive to youth, an energy that supposedly fades with time, replaced by duties, limitations, or social beliefs that try to mold the elderly as asexual, uninterested, or incapable of feeling desire. This view is not only incorrect, it is cruel. Desire has no age, pleasure has no expiration date, and among the most accessible and meaningful ways to keep this dimension of existence alive is masturbation. In old age, masturbation takes on a new meaning, more mature, more conscious, more focused on self-knowledge and self-care. Far from being just a response to sexual impulse, intimate touch often becomes a gesture of connection with one's own essence. The body no longer responds as it once did. Sensations change, but it is precisely in this new rhythm that one can discover other ways of feeling, exploring, and being moved. Masturbation does not have to be rushed or aimed solely at orgasm. It can be slow, meditative, careful, full of presence. It can be a pause in the day to simply listen to your body and realize that it is still capable of feeling pleasure, tenderness, and warmth. Intimate touch in old age is not just a right. It is a legitimate way to preserve dignity. Aging is often about witnessing a series of losses: work, independence, loved ones, physical energy. But within each individual, something essential remains: the right to pleasure. When an older person allows themselves to touch, feel, and be moved by their own body, they are silently saying, "I am still mine. I still inhabit this body. I still deserve to feel." This attitude has a profound impact on self-esteem, self-image, and the sense of belonging to oneself, especially when the world around them sometimes insists on treating them as invisible. Masturbation also has the power to create an intimate routine of self-care, functioning as a kind of emotional hygiene. In a world where affectionate touch can become scarce over time, whether due to the absence of partners, widowhood, or family estrangement, self-touch takes on a vital role. It calms, reconnects, and stabilizes. Many older adults report that even without sexual relations with other people, they continue to feel alive and desirous through masturbation. This is because pleasure does not come only from another person. It is, above all, a language of the body with itself. And cultivating this language is a way of keeping the flame of vitality alive. Furthermore, it is important to recognize that sexuality in old age does not need to, nor should it, follow the same patterns as in youth. The focus is no longer on performance, quantity, time, or the expectation of pleasing another person. Rather, it is in the depth of the experience, in listening sensitively to the body, in the freedom of not having to prove anything to anyone. Masturbation in this context is liberating. It requires no explanation. It does not demand perfect bodies. It does not depend on external approval. It is a moment where there are no judgments, only presence, only the intimate pleasure of being who you are, in the skin you are in the time you are living. From a psychological point of view, regular masturbation contributes significantly to reducing anxiety, sadness, and feelings of isolation. Pleasure stimulates the release of endorphins and dopamine, hormones linked to well-being, joy, and relaxation. Many older adults experience insomnia, anxiety, or feelings of existential emptiness. A moment of masturbation conducted with affection and awareness can act as a regenerative pause, an emotional balm that relieves tension and allows for a reunion with good and comforting sensation. From a physical standpoint, masturbation helps maintain active circulation in the pelvic region, stimulates the genitals, and can even contribute to hormone regulation, especially in men, where testosterone release and prostate function are directly linked to the frequency of sexual activity, as discussed in other topics. In both sexes, intimate touch improves knowledge of one's own body, which is essential for identifying changes, pain, discomfort, or medical needs more clearly and quickly. However, all of this is only possible when pleasure is experienced freely, without guilt, shame, or fear of judgment. This is still a challenge for many older adults who were raised in times when intimate touch was taboo, a sin, a hidden practice. What is needed then is a movement of redemption, of intimate re-education, where it is recognized that feeling pleasure is human, natural, and healthy. Masturbation is not a sign of neediness, loneliness, or moral weakness. It is a sign of vitality, autonomy, and emotional health. A body that feels pleasure is a body that still pulses, still dreams, still lives. For a long time, perhaps centuries, we were taught that sexuality was an exclusive privilege of youth. Culture, religion, silence in families, and medicine itself reinforced the idea that desire fades with age, like a flame that goes out when the candle burns out. This collective imagination has shaped entire generations to believe that upon crossing the threshold of 60, 70, or 80, the body becomes neutral, devoid of desire, stripped of any form of sensuality. As a result, millions of older people live in silence, suppressing their desires, their touch, their orgasms, and their longing, not because they have lost the ability to feel, but because they have been taught to feel ashamed for still feeling. And it is precisely this shame, this invisible censorship, that we urgently need to deconstruct. Talking about sexuality in old age is more than a public health issue. It is a matter of human dignity. Sexuality is not just a physical act. It is also affection, identity, a desire for connection, an expression of self-love and vitality. It does not disappear with gray hair, wrinkles, or retirement. environment. It may change, transform, adapt to new rhythms, but it remains there, alive, pulsating, just waiting to be legitimized. The first taboo we need to break, therefore, is this. Aging does not mean losing your sexuality, much less the right to experience it. Another taboo that imposes itself with cruel force is that pleasure in old age is something indecent or shameful. How often do we hear embarrassing jokes about elderly people in love, or see disapproving looks at an elderly couple holding hands and exchanging public displays of affection? Society still treats the sexual expression of older people as if it were a mistake, an anomaly, a regression to childhood, as if the mature body could no longer be moved by a touch, a kiss, an intimate moment. This view not only dehumanizes older people, but also pushes them into emotional and sexual loneliness that has no justification. Desire in old age is not ridiculous, it is human, and it is healthy. We also need to understand that sexuality in old age does not have to follow the same patterns we know from our youth. The model centered on penetration, performance, speed, and immediate orgasm no longer makes sense for many people as they age, and this is not a loss, but an opportunity. Sexuality can become more sensory, more effective, more profound. Touch takes on new meaning. The gaze, smell, and skin take center stage. Masturbation, once seen as an emergency resource, is being rediscovered as a practice of self-care, self-knowledge, and genuine pleasure. It is not a plan B. It is a legitimate way of relating to oneself. Another deep-rooted taboo is that aging eliminates sensuality. This is directly linked to the culture of eternal youth, which idolizes young, defined bodies and marginalizes any sign of aging. But eroticism does not reside solely in the body. It resides in presence, in intentional touch, in the mature desire to surrender, in the experience of those who know their own bodies and are no longer in a hurry. There is a sensuality that comes from calmness, respect, and listening, and this sensuality is often richer than that based solely on physical appetite. When we accept this, we stop seeking an unattainable ideal and begin to value what we actually have, a real body with history, with marks, but still fully capable of feeling. It is also important to talk about the taboo of masturbation in old age. For many, it is still difficult to imagine older men and women touching themselves, exploring themselves, giving themselves pleasure. This is rooted in archaic views that associate masturbation with sin, loneliness, and addiction, when in fact it is an intimate gesture of autonomy, of respect for one's own needs, of continued affection for the body. What's more, it can be a therapeutic tool for dealing with anxiety, insomnia, and loneliness. Instead of denying or hiding it, we need to normalize it. There is nothing wrong with it. It is in fact a great gesture of freedom. Reaching 60 or beyond does not mean the end of sexuality. On the contrary, it can be the beginning of a new phase, one that is more mature, freer, and in many cases more satisfying. However, maintaining a healthy sex life after 60 requires a conscious look at the body, mind, relationships, and physiological aspects that change over time. And no one is better than a urologist, a specialist in male reproductive health, to offer clear, practical, and respectful guidance for those who want to continue experiencing pleasure with fulfillment, dignity, and well-being. The first tip is also one of the most fundamental. Understand and accept the natural changes in your body. Aging brings hormonal, vascular, neurological, and even emotional changes that directly affect sexual response. It is common, for example, for erections to take longer to happen, for orgasms to be more subtle, or for desire to arise differently, less explosive, more serene. This does not mean that there is anything wrong. On the contrary, it means that the body is entering a new rhythm, and respecting this new timing is essential. Forcing the body to function as before can lead to frustration, anxiety, and even shame. The secret lies in understanding that pleasure is still possible, just in a different way. The urologist's second piece of advice is to keep up with your overall health, as sexuality is deeply linked to the body's overall condition. Diseases such as diabetes, high blood pressure, obesity, and heart problems have a direct impact on male sexual function, especially erections. Blood circulation is key to the penis filling with blood and sustaining a satisfactory erection, and any condition that impairs this flow compromises sexual response. Therefore, controlling blood pressure, maintaining balanced glucose levels, avoiding a sedentary lifestyle, and taking care of your diet are actions that, in addition to protecting your life, preserve sexual potency. A healthy body responds better to stimuli, and pleasure becomes a consequence of broader health care. Another point highlighted by many urologists is the importance of maintaining a regular masturbation routine, even in the absence of sexual partners. Masturbation helps keep penile tissues oxygenated, stimulates the production of sex hormones, reduces stress, and even contributes to prostate health, as we have already explored in another topic. Many men, when they stop masturbating for long periods, notice a loss of sensitivity, difficulty achieving erections, or discomfort in the pelvic region. Self-touch is, therefore, a way to keep the sexual system active and functional, as well as being an intimate opportunity to experience new sensations in the mature body. Talking to your doctor without taboos is also a crucial tip. Unfortunately, many men avoid bringing up sexual issues during consultation. conversations, whether out of embarrassment, fear of judgment, or because they think it is a thing of age. This omission can delay diagnoses, prevent effective treatment, and keep patients trapped in unnecessary insecurity. Erectile dysfunction, loss of libido, premature or delayed ejaculation, pain, reduced sensitivity, all of these can and should be discussed with a urologist who is there to guide, not criticize. Today, there are a variety of effective treatments, ranging from lifestyle changes to medications, therapies, or devices that help restore confidence and sexual pleasure. But it all starts with open and respectful dialogue.